Assalamualaikum warahmatullahi wabarakatuh. Good morning, ladies and gentlemen. I would like to say thank you for coming to my presentation today. It's great to see you all. Okay, let me introduce myself. My name is Ristiya Gustini. I'm from Class 2A D3 Nursing. On this occasion, I will present about child nursing. Okay, before I get to the core of the material, what is child nursing? So, pediatric nursing is a health science that focuses on the welfare of the child so that the nurse is comprehensively responsible in providing child nursing care. Well, what I will discuss this time is about the growth and development of children aged 0 to 1 year. Okay. Okay, for the understanding of growth and development, you can see it on the screen. Each month, the baby will show new development to support his future abilities. Keep in mind that the developmental stage of newborn is one cannot be generalized. This is because their health conditions are different. So don't worry too soon if your little one doesn't show the same development as other kids his age. Okay, furthermore, the pattern of child growth and development, the first pattern of directed physical development, there are two principles, namely caudal and proximal distal. This is caudal. Is a pattern of growth and development that starts from the head, which is characterized by change in the size of a larger head, then develops the ability to move faster by shaking the head and continues to the lower extremities of the arm and legs. For example, from the neck to the shoulder to the mid-torso and so on, the same pattern occurs in the head area. The upper part of the head, the eyes and brain grow faster than the lower part. Next, proximal distal. It is a pattern of growth and development that begins with moving the limb closest to the center of the mid-axis, such as moving the shoulder first and then the fingers. So growth starts in the middle of the body and then moves to the feet and hands. An example is the early maturity of trunk and arms muscle control compared to the hands and fingers. Okay, this is next the pattern of development from general to specific. That is pattern of growth development pattern that begin with moving the more general areas first and then the more complex areas. For example, wave your hand and then play your finger. And part 3, the pattern of development is influenced by maturity and learning practice. This pattern reflects specific characteristics in each developmental stage that can be used to early detection of further development. This period is divided into 5 stages. First, part A, prenatal period. There is a very fast growth in the organ and tissue of. B, in neonates, there is a process of adjustment to life outside the womb and almost a few aspects of physical growth are changing. C, infancy. Development occurs according to the environment that influences it and has many abilities to protect and avoid things that threaten it himself. D, childhood. There is a rapid development in aspect of nature attitudes, interests, and ways of adjusting to the environment. E. Adolescence, there is a chance toward adulthood so that maturity at the seasons of puberty. Okay. Okay. I will I will discuss the factors that influence the growth and development of children. Can you see the screen? Okay. There are two things that affect growth and development, namely environmental factor and heredity factor. Of course, environmental factors are factors that can be avoided. Manual heredity cannot be regulated anymore. One of the things that is often considered related to heredity is height. Usually, short parents will have short children and vice versa. Okay, export. Mm, wait. Okay, next part is the first stage of child development, cognitive development. Okay, the next part is the first stage of child development, cognitive development. What is cognitive development? Children cognitive development refers to the stage of the little one's ability to gain meaning and knowledge from experience and information obtained. In short, motoric development is related to the process of remembering, decision making, and problem solving. Then the second, psychosexual development. Yes. Then the second, psychosexual development. At this stage, the baby gets pleasure from the mood. In addition to breastfeeding, the baby will continue to play with his mouth, with his fingers, for example, and continue to explore this part by putting all kinds of object in his mouth. This stage related such as beating, chewing, or inserting object around it in the mouth. From 0 to 3 months, baby enjoy pleasant face-to-face interacts with people. Babies also smile and log in respond to pleasant interaction. Then the age of 4 to 6 months can enjoy pleasant interaction with other people, such as chilukba. Nah, then they make noises in response to a pleasant interaction. In addition, they like to play with toys with varied texture. They also enjoy playing musical toys, raising their arms to be put up and enjoying a variety of movements such as banging swing. At the age of 7 to 9, babies in this category are interested in interacting with other people. For example, they do chilukba. They enjoy playing with musical toys and interest in playing with colorful objects, then raise the hand toward the adult to be carried. They also maintain eye contact with people during pleasant interaction. They also like to move around the environment when placed on the floor. Finally, at the age of 10 to 12 months, babies begin to be interested in interacting with other people. Babies can maintain eye contact with people during pleasant interaction. They also turn their head in response to the name being called. They can already point to objects of interest. Baby at the age can enjoy playing with toys of varying texture. They like to play and dance with musical toys. They enjoy various types of movement and often explore the environment for the desired toy. Okay, then for emotional development, he also begins to be able to imitate some movement and facial experience of adults, such as frowning and smiling. His emotional fluctuations began to change rapidly and become more diverse. His anger was often seen. This emotion will then peak until they become tantrums in the next age range. Okay, this is then special characteristic of children emotional experience. First, strong emotion. Two, emotion often appear. Three, emotion are temporary. Four, action reflect individuality. Five, emotion can strength. And less emotion can be identified through symptoms behavior. Okay, common emotion patterns. A few a few months after the baby is born, perikins appear emotional pattern. The most common pattern, the stimuli that evoke emotion and reaction that are typical of each pattern below, among others. First, care. Stimuli that commonly cause fear in infancy are loud noises, animals, dark rooms, hide place, being alone, pain, people unknown, and a place and objects. Okay, and Sam's the fear of strangers that causes embarrassment is in change in babies. Attitudes after they become accustomed to getting to know people they already know. Okay, for problem that often arise at the age of 0 to 1 years. First, gastrointestinal disorder. Two, sensitive skin. Three, tongue often appears white like a fungus. 1, 2, 3, 4, sorry. Four, breath grog. Uh, Five, frequent sneezing, runny nose, a lot of nasal discharge, head often tilted to one side, so there is a risk of a bloated head, due to a blocked nose or ringing dominantly only on one side of the breast. Because the nose is blocked and breathing with merely drinking breath will often chokes. And six, eyes are often watery or frequent eye discharge on side or both sides. Seven, frequent sweating or excessive. Eight, due to excessive drinking or frequent request to drink resulting in overweight and obesity. Age, 1 year. On the other hand, weight loss occurs after the age of 4 to 6 months because eating and drinking are reduced. And nine, the head, palms, or soles of the feet often feel warm. And the last, anatomic nerve disorder easily started by disturbing sounds Movement of hand, feet, and lips are often shaking. The legs are often extended, straight, and stiff, breath holding still. When crying, the breath stops for a few seconds, sometimes accompanied by blue tips and stiff hands. The eyes are often closed, strabismus, caesura with the EAD disturbances normally easy. Okay, to conclude, it every age children have their own developmental characteristic, but physical growth and fine motoristic is in children as 0 to 1 year. In their gross motoric skill, the child cannot stand on their own independently. In their fine motor skills, they can climb objects with their fingers. Okay, that's all I can say about the growth and development of children. Hopefully, it will be useful for us. Thank you for attention. Wassalamualaikum warahmatullahi wabarakatuh.